The purpose of having a female training mannequin is to afford our soldiers and military health system the ability to train in a real life scenario. We've found through the Department of War that there is a deficit from research coming out of Afghanistan and Iraq. Female survivability was at 35%, while male was at 12%. So we've identified that this mannequin will bring that ability to triage females better. The capabilities of this MATTi female training mannequin is to have some hidden wounds that aren't typically observed through triage of medics. Again, coming out of Iraq and Afghanistan, that was one of the things that was noted by combat medics is they haven't trained with females. And so she affords us that, and also she has the capability of giving us back data, real feedback that shows us pressure is applied appropriately, volume is less. Females have 12% less volume of blood than males also. So in trauma, time is tissue. Female training mannequin for our warfighters helps us to train in a military health system where we can get all warfighters back to the fight versus just concentrating on male mannequins. It gives us more realism, it gives us modernization across the front, and we can do a full spectrum of clinical care for our females as well. Army Reserve units, whether they're medical or just a warfighting unit that have medical personnel, can come to one of 3 medical regional training sites at either Fort Gordon, Camp Parks, or Fort McCoy. We can coordinate with units to get the training, get their hands on these mannequins, and incorporate that to whatever other training objectives they have, either clinically or just their commander's training objectives.